Oui, Mario est prêt. Bonjour à tous et à toutes.
Hello, everybody. Welcome to this press conference with Premier Legault, Health Minister Christian Dubé, and the Health Director, Dr. Horacio Arruda. Mr. Premier, the floor is yours.
Bonjour tout le monde.
Hi, everyone. Today, we have, well, actually yesterday, we had 656 new cases. So as we've seen over the past few weeks, we remain around 700 new daily cases. And that means that Quebec is resisting. Quebec is resisting the variants. Quebec is resisting the third wave. That's not the case everywhere throughout the world. We saw in France and in Italy, they had to reconfine, and we're seeing it in some states in the U.S., amongst others, Michigan and Detroit. The number of new cases has doubled over the past 2 weeks, and it continues to be difficult in New Jersey and Massachusetts. Even when we look in Canada, there was a strong increase in the number of cases in BC, in Alberta, in Ontario. In Ontario, they've even declared that they were in a third wave. Well, for us, there's all sorts of definitions, but we are not in a wave since there is no increase in the number of cases. There's a stabilization, actually, but there's no increase. So things are going well, and that means that our measures are working. But, the war has not been won. So we have to continue to be prudent over the next few weeks. The next few weeks will be determining. I'd also like to remind you that, yes, people are getting vaccinated, but it takes 3 to 4 weeks after vaccination to have the full effect of the vaccine. So things are going well, and actually, I'm hearing good comments. I think the organization from the Ministry of Health is impressive. Today, by the end of the day, we should have reached 1 million people vaccinated. By the end of the day today, we should have 1 million Quebecers who have received their vaccine, and it continues to accelerate. Over the next few days, we will be close to 50,000 vaccines a day. So congratulations. Bravo to Christian and the whole team. Once again, when we compare ourselves, well, the choice that was made to proceed just with the first dose in order to vaccinate as many people as possible, well, that is giving us the result that right now, when we look at all the provinces, there's only Saskatchewan who has vaccinated a bit more of their population than we have per capita. So we're ahead of all the other provinces. And that's a wonderful success story up until now. However, the variants are more and more present. We're at 30%. We've said this eventually next month. Most of the new cases will be variants, so we have to continue to be prudent, and that is why today, unfortunately, we cannot announce big easings of measures. Actually, I am announcing 2 easings of measures today. First of all, high schools, so secondary 3, 4, and 5 in red zone, as of next Monday, the 29th of March, will stop the hybrid system. So students in Sec 3, 4, and 5 throughout Quebec will go to school every day. And for me, that is wonderful news, because that's where our children should be, in school every day. And that will be the case throughout the province, even in the red zones. The other good news has to do with our elderly in seniors' residences. We've done vaccination in all the residences. So as of tomorrow, all of the seniors' residences where there's more than 75% of the seniors that were vaccinated over the past 3 weeks, we can open the lunchrooms. So I think it'll be good for a lot of our elders to be able to have lunch together and to see other people who live in their residence. But all the other measures stay in place, so there's no change in the alert levels this week. However, I want to call on two regions. You saw that there's a significant increase in the Saguenay-Lac-Saint-Jean and in the Outaouais region in the number of cases. We believe that we are able, by being careful, we're able to remain at the orange level. However, it's important that we reduce contacts. There was an increase of contacts over the past few days and weeks, and it's important in the Saguenay and in the Outaouais. We don't want to come back to a red zone, so let's be careful, in particular in these zones. But let's be careful everywhere in Quebec. We could get hit by a third wave, and if we want to avoid this third wave, well, we must do two things. First of all, we must respect public health measures. And when we said last week that we would push back the curfew from 8 to 9:30, that does not mean that it's in order to go visit people or to go in other people's homes. That is still prohibited, visits to other people's homes. The second measure that is very important to respect is that when it is your turn, you go get vaccinated. And now it's my turn. We announced in Montreal that people 60 and up can now register for a vaccine. So I've asked the people on my team to register me where there was space available. I don't want to take anybody else's space. So I'm going to get vaccinated in Montreal on Friday. And you can come see if I'll be less scared than Christian. I do not know yet which vaccine I will be given, but regardless of the vaccine, and it's important to say this, I am ready to be vaccinated, to take any one of the three vaccines. All three vaccines are safe. All three vaccines are effective. So, of course, I hesitated because I didn't want to jump the queue, but now we're at people 60 and up. I'm leading by example, and I hope that this will inspire all Quebecers when their turn comes to go get vaccinated. I will close by going back to an old tradition, my thanks of the day. I want to thank people who work in CHSLDs. I spoke with a lot of people concerning the situation in CHSLDs. We know that last summer we added a lot of employees. We are now at more than 8,000 new orderlies, and there's a bit over 1,000 that are now being trained. So slowly but surely, we're going towards our 10,000 orderly objective, and we also have, and Christian handled this, we've named a boss in each CHSLD. And that may seem like nothing, but you will see in the budget, and that is not news in itself because these are decisions that were made last summer. But we're talking about an investment of $750 million, and that is recurring in health. And that means that every year, the additional staff that we have put in place or that we will put in place in the CHSLDs, this is an investment of $750 million. But honestly, and I've said this often, it's my greatest pride because we were all embarrassed with the way when we saw the services that were given last spring. So when I'm told that the quality of the services has greatly improved in CHSLDs currently, and we will continue to make sure that it gets even better. Well, that is thanks to the employees that we've put in place. I'm told that things are working well between the older and newer employees. Of course, it's not easy to see 9,000 new employees flood the labor force out of 40,000. It kind of changes the atmosphere and the context, but I am told that things are going quite well between the older employees and the newer employees, and that are elderly, well, we have a bit more time to spend with them. So for me, that is something that is very important. These are people who have built Quebec, and we owe this to them. So thank you. That's my thanks of the day. It's for all the orderlies and all the employees and doctors who work in the CHSLDs.
Good afternoon, everyone. We're resisting against the variants and the third wave, but the battle is not over. We have to stay careful as we accelerate the vaccination. We should reach 1 million people vaccinated today, and I want to thank all our teams across Quebec. The situation in coming weeks will be decisive. This is why we must wait before lifting other restrictions except for 2 measures. I'm announcing that starting March 29, high school students will go to school every day. That's great news. It's important that young people go to school. And we have a good news for our elderly. Vaccination is almost done in senior homes. And I'm announcing that as of tomorrow, in senior homes, where at least 75% of residents received the vaccine since 3 weeks, dining rooms will reopen. Apart from these measures, we're not announcing any changes today, and I want to send a warning to people from regions of Outaouais and Saguenay-Lac-Saint-Jean. I ask you to reduce your contacts as much as possible. So we have the opportunity to avoid a third wave, but in order to do that, we have to follow the rules for a few more weeks. No one wants to come back to a lockdown. I'm counting on you all. And when it's your turn, it's important to get the vaccine. That's why I'm going to get vaccinated in Montreal next Friday. Thank you.
Merci. Nous allons
Thank you. We will start the question period.
Bonjour.
Question. I have some questions concerning vaccination. The regions that are under surveillance, for example, the Outaouais, and I would add perhaps Lower St. Lawrence and the Saguenay, could there be more doses sent to those regions? We know, for example, that there are some people in the Saguenay who are asking for more doses. Well, listen, for the time being, I'll take the example of the Saguenay. It's a very good question. The Saguenay has received doses according to not only its population, but the types of people that we wanted to vaccinate, in the priorities, the seniors' residences and the CHSLDs, so they got their doses. I think that it's an issue, and I talked about this morning with my colleague, André Laforêt, and I think that what happened more recently, you'll remember when there was an increase in cases, I think that people, they got more serious about it quite quickly in the Saguenay-Lac-Saint-Jean, and I think that there's no reason to increase the number of doses, but I believe that getting through the message to follow the public health measures will do. On the Outaouais region, we decided to adjust the number of doses. It's a minor adjustment, but it's still important. When I look at the big picture, the proportion of CHSLDs and RPAs in the Outaouais region was much lower than elsewhere in Quebec, probably because of a younger population, and that is why when we compare their population versus the same proportions, the targeted categories, in the beginning they receive fewer doses, and we decided to increase by 3,500 the number of doses that they're getting. So 2,200 this week and 1,300. But these are minor adjustments because I think that in both cases, respecting the measures will be sufficient. But Dr. Arruda specifically sent very clear messages, and he can talk to this. He told the public health directors to make sure that the measures are well respected, and that's why we say that they're being monitored right now. Again, with vaccination, you had announced that we would review some of the priorities, for example, for chronic illnesses, but we didn't get a lot of details on this, on how this is going to work. What will be the criteria? How will we demonstrate that we have a chronic illness? Can we have more details on this? Well, there are no details right now. What we have asked Dr. Arruda with Public Health, we've asked him to look, but before handing it over to him, I would tell you that we've already made some changes. We decided that in home care, given that we had certain vaccines, the AstraZeneca example allowed us to vaccinate in the home 20,000 people, which we were not planning on doing, in addition to their caregivers. So there was an exception for 40,000 people here. Secondly, we looked at people who are handicapped, either intellectually handicapped or physically handicapped. In our RI, the group homes, we've added another 13,000. So we are making exceptions, but we need vaccines to make these exceptions. So obviously, there's a lot of people who are asking us to make exceptions, but I will let Dr. Arruda talk about next steps. We have to understand that prioritizing is necessary. When we will have enough vaccines, the 7th, 8th, 9th, 10th, perhaps they'll be quite parallel, those groups. The Institute has made a recommendation, a general recommendation, and what we've done is that we asked a clinical committee that gathered on Monday to, because this is patient treatment, we were going to get some recommendations according to the risks. This is a clinical table with all sorts of specialists, and they will come to a consensus that will allow us to put in place that list. For example, when we're talking about chronic illness, which ones present the greater risk? When we talk about cancer, or, is it somebody who's taken chemo or not? All of this will be established, and this list will be made public and known shortly, so that we can apply it and integrate it into the process. Question? My first question is for you, Mr. Legault, concerning Louis-Charles Touin and the revelations in the Journal de Québec et de Montréal this morning. You were part of the selection process for all of your candidates. In light of what was revealed this morning, were you aware, and why was it acceptable at the time? Well, first of all, I am not aware, and I was not aware of any actions that did not respect the law or the rules. So there are a lot of things that were said, and there are some questions that we must ask, like the presence of l'UPAC. Mr. Touin is not aware, and I'm not aware of this, so we need to find out if it's true. Then, if we look at the SPCA, this is something that was already analyzed, and it was judged that there was no conflict of interest. Now, all the questions of the changes of zoning laws, we explained that there was no conflict of interest. So according to the information that I had and that I still have today, there's nothing illegal that was done by Mr. Touin. No illegal action. So currently, there's an inquiry being done by the Ethics Commissioner, so we'll wait to see if there's anything new that comes to light. But we had the opportunity to speak to Mr. Touin, and there is nothing illegal that was done. The opposition parties are still asking that he be excluded from your caucus. And we're referring to you. When you were in the opposition, you were much more severe, and that you were actually in a zero-tolerance mode for conflicts of interest. Now, your definition of conflict of interest, has that changed since then? No, currently, there is no conflict of interest, according to the information that I have. So I have not changed my mind. Question? Mr. Legault, I'd like to speak about Mr. Touin as well. I would like you to tell us, what you're saying is that the actions that were undertaken are not really severe. There's an appearance of a conflict of interest, but in the past, with the choices that he's made in the past, does he still have his spot at the Treasury Board? Well, according to the information that I've got, there is no conflict of interest, so the question is moot. Now, the ethics commissioner will do an investigation. We will see the results of this investigation, but according to the information that I have, there is no conflict of interest. And Mrs. Lebel, is she still comfortable working with Mr. Twain at the Treasury Board? Well, we'd have to ask her the question, but I think that I haven't heard anything to the contrary, so I don't think there's any problem there. You have to understand, just so that everybody understands, the role, Mr. Twain's role at the Treasury Board as a parliamentary assistant is to work so that all organizations, the paragovernmental organizations, buy more Quebec products, including the municipalities. So that's his role. Question? Hello. Mr. Dubé, I wanted to hear what you had to say about the surgeries, the non-urgent surgeries that have increased. We're talking about 17,000 surgeries approximately that were delayed by a year at the end of January. In this context, when do you expect to come back to pre-pandemic levels, if we take into account that it's continuing to increase month after month? Well, first of all, unfortunately, it's going to continue to increase for a certain amount of time, as long as we have not stabilized the network. And that is why we publish every week the percentage of postponements, which has greatly improved, actually, since over the past few months, but it continues to be below 100%. So that means that right now, we are not working at full capacity when it comes to surgeries. You'll remember that when we started to measure this, we were between 50 and 60% capacity. Now, thanks to the private agreements that we have signed with clinics, we're at 83 to 84%. So we were able to get closer or to minimize the postponements as much as possible. But as long as we continue to be below 100%, well, I'm telling you that we'll have a hard time catching up this delay, because we perform less well for all sorts of reasons, less staff, etc. That's the first thing. So we have succeeded, thanks to the agreements with private clinics, to minimize this, and those are the stats that we publish every week. Now, I believe that with the stabilization of the cases, and that is why we're still worried about the variants, I'll remind you that there's still 40 to 50 people every day that come in, and they're COVID patients. That's why we have a plateau in our hospitalizations, because we get 35 to 40, 45 people every day come in with COVID in all of our hospitals, particularly in the Greater Montreal regions. And we know this, and we are in discussions with the different associations. Over the past 2 weeks, I've met the radiologists, oncologists. I've met most of the people, emergency room doctors, most of the people who are involved in this, and I've asked them, with Dr. O'Patterney, who you know, to finalize a plan. But the first thing that they tell us is stabilize a network for the time being, and that is why we are in discussions as well with the FIC to be able to see what is the arrangement that we can come to in order to bring this back to 100% as quickly as possible. And then afterwards, we can start working on the backlog. So I'm very transparent with you. We're not there yet. There's been a big improvement over the past 2 months, but there's still a lot of work to do. So an improvement since the end of January? Well, yes, for sure. But like I'm telling you, if we're able to stabilize our network, well, I think that we'll be able to work on the waiting list. But we're not there yet. I wanted to hear you on Stephen Bronfman's intentions to go get some public funds for his stadium project in Montreal. What is your interest in this as a government in investing public funds in this project? And if there's an interest, what would it look like? Well, I would draw a parallel with what we've talked about quite a bit over the past few weeks, of famous forgivable loans for businesses. And of course, a business that brings a baseball club to Montreal is also a business. First of all, our objective. When we compare the richness or the wealth of Quebec with Ontario's GDP per inhabitant, we've got a $12 billion gap. So if we had the same GDP per inhabitant as in Ontario, we would have $12 billion more in revenues. per year. But from that, we have to take away a decrease in the transfer payments, but that too is part of our objectives, to be less dependent on the transfers. Now, when we help a business and that we provide a loan, and that we say, well, first of all, we make sure that the loan is safe, it's guaranteed, it's made to a company that has good financial health. But now when we say that part of the loan is forgivable, that means that we are ready to offer a subsidy that is inferior to the additional revenues that come in to the government's coffers. And that's the advantage of the loan. It's to say that in 5 years, we're not making any forecasts. We're looking at the additional revenues that come into the government's coffers that would not have come otherwise. So I'm going to come back to the baseball team. If tomorrow morning there's a baseball team in Quebec, there would be some players who would pay income tax in Quebec. Income tax that we would not have if we did not have a baseball team. So if we take part of this tax income and that we give it to a business that brings us that baseball team, well, everybody's winning, because Quebec, what we have to make sure of is that Quebec will receive more spin-offs than the subsidy that would be given to a business, including a baseball team. So that's, in that sense, we are open to the project. There are several business people, well-known business people behind this project. There's not just Mr. Bronfman. So if we're able to bring a baseball club to the province and it brings more revenues than the help that we give to the business, well, everybody wins, including Quebecers. Question? Mr. Dubé, you're talking about of opening dining rooms in RPAs where more than 75% of the people have been vaccinated. The care staff in the RPAs is vaccinated, but the people in the lunchrooms are not vaccinated. So what happens with them? Well, listen, we have to look at all of the staff that we have. We believe that with the life environment, it's still an environment that is quite closed. We're not in a restaurant. It's all of the people who were vaccinated. So I think that the recommendation from public health is clear. It's that we can take this analysis and say this life environment was vaccinated, even if not all people were vaccinated, because we're not there to exclude anybody. And I think that perhaps Dr. Arruda wants to add to this. We consider, well, most of the environments had more than 75% of the people who were vaccinated, the residents, and they are the ones that we want to protect. They're at risk of complications. So these are not buffet rooms. It's an opening, kind of like in restaurants. So it's two bubbles that can be together, let's say 2 units, or they're very small tables, several services, disinfection, plexiglass if necessary. So it's a reopening to allow people to socialize and to see each other, but it's not a return to normal. There's all sorts of measures that will be sent by communique, and the establishments, the RPAs, will get correspondence that will explain exactly how to proceed. But after 3 weeks, once people have been vaccinated, we can reopen the lunchrooms, but in a very prudent context. Now, for the politician and the scientist, when does it become safe to hold elections in Quebec? The politician is me, I guess? Well, not provincial elections. I'm talking about federal elections, of course. Well, listen, we will consult public health. There were some examples in Canada, in certain provinces, elsewhere in the world as well. And the situation will evolve over the next few months. So I think it must be done by respecting the appropriate public health measures. But eventually, perhaps we can think that when we're ready to do all of this by internet, but from what I understand, the director of elections is perhaps not ready for this. So obviously, in any case, we must, at the time of the election or at the time of the campaign, when we know that there will be an election, we must consult public health. It will depend on what's submitted to us. There will be some protocols. There will be masks and physical distancing, etc. And we have to avoid gatherings. I think it's possible to organize it in this way. We'll see where we are, and we'll see where we'll be. It's very hard to forecast. You know, even 2 to 3 weeks for us is an eternity with COVID-19. When we talk about elections, maybe in October at some point at the federal level. It could be June. June? Well, it could. Well, listen, like I'm saying, we'll do the analysis, and we will apply the same principles that we apply in any other gatherings. So, Dr. Rita, you expect that you will be consulted by Elections Canada? It's clear that given that it's happening on our territory and it concerns our population, we will ask that it be submitted to us. That's clear. Question? I would like to clarify a point on vaccination, perhaps with Mr. Arruda and Mr. Dubé. We received, well, somebody recovered from COVID-19 and is wondering if that person should be vaccinated anyways, and if this represents a first or a second dose, because it's not clear. Once we've had COVID, if we have some immunity, because we got a communication from Santé Montréal that says after verification, it is confirmed that it's a procedure. If somebody got COVID-19, confirmed, they only need 1 dose of the vaccine to be considered adequately vaccinated. We sent the same question to your office and it didn't seem clear. So what is the guideline? If we were contaminated by COVID-19, is it like getting 1 vaccine dose? If you'll allow me, what we know is that immunity associated to the illness perhaps doesn't last a long, long time, and that is why we recommend another dose. But if you already had the illness, we've got lab confirmation of this. We believe that after 3 months, you can get a first dose, which will have the same effect as a second dose. We do not recommend a second dose. So the illness, a dose and a dose, because it doesn't give any more protection. And it brings about more adverse reactions. You will react more strongly. You'll be like sick for 7 or 8 days without the benefit of improving immunity. So our clinicians, the people in charge of immunology, say that once you've had COVID, you get 1 dose of vaccine, but not necessarily 2 doses. It's not necessary. So if I understand well, if we've had COVID, when we get the dose, do we have to mention it at that time? Because we're told that, we make an appointment for the second dose. You can mention it. And what will be done as well is that we will merge the lab banks with our vaccine registry to check in the lab's file, do we have your name with a positive test? Then that will show in the vaccination file, and you will be considered as being immune after receiving only 1 dose. So it will show in the file directly. If the test was done, yes. Perhaps there are some people who got COVID and who did not get it tested. Well, then, during the clinical evaluation, there's a discussion with you to see, is it really the illness, according to the information that you're sharing, or they may recommend 2 doses. It will be done on a case-by-case basis. Question. I would like to come back to the color code in the regions. You talked about the Saguenay, the Outaouais. According to the threshold for the red zone, they would be under that threshold for the past few days. So I'd like to know, at this stage of the game, and if the pace, or at this pace, is it probable that the Saguenay and the Outaouais will go to red? And otherwise, how much time do you give them to stabilize things? Well, listen, it's probable. Anything is possible, but right now what we're seeing in the Saguenay was like that. They had quick increases and quick decreases, and we don't want to play yo-yo, right? It's not because we go from orange to red for a few days or a week or two, it's going to depend on the acceleration. If we see a decrease in cases, well, they will remain orange. We look at it day to day, and we take into consideration several aspects. The first one is the number of cases, how many people have been hospitalized, our capacity to do contact tracing, what is the type of outbreak that we've got, is it with variants or not, and what is the... So all of this is looked at, not just the number. There's a number of cases that gives us a color, but we also have to look at the other elements as well. And that's an analysis that is done with public health to see, to understand exactly what's happening in the territory. Well, for example, the zone will not go to red for a few days to stop the bleeding, let's say. Well, when we put a... Well, it has consequences, right? When we go to red and take away the red and put it back to red, people, restaurants open and then they have to close down. So that's not what we want to do. If we think that we must go to red, it's because we have the impression that we are losing control and things are accelerating, and it's going to last for a while. On the variants, Gaston Nassau was saying today that we have to review our strategy, our screening strategy or contact tracing strategy. Now, when we have a presumed variant case, we've got more severe measures for the contact tracing and all of that. Should we review the strategy and extend it to all cases right now, given the evolution? I would tell you that most of the public health departments treat them like variants. For all cases, yes. Of course, when there's big numbers, like in Montreal, they will do it. They will do more than usual, but not as if they were all variants. So it's variable. But right now, in many regions of Quebec, whether it's a variant or not, we've got a very aggressive approach. And that allows us, despite the fact that we've got an increase in variants, of not seeing a big increase in cases. But I would tell you, we're not in the third wave. We're in a plateau after the second wave. But we know that it's going to increase. Independently of what we do, it's not true that the variant's not going to increase. And because it's more contagious, we're going to have more cases. What's important is not to have the hospitalizations and deaths that follow. And that is what we are working on. It's a very aggressive approach, and we're asking people to collaborate. And I want to insist, and I'll repeat myself again, if you have any symptoms, if you have fever or sore throat or your nose is running, don't contaminate other people. Go get tested, and we will take care of you. And when we get tested, we have a quick reply, right? A quick answer. So collaborate, please, and that is what will help us. Not go back to red and... On the question of screening, because we talk about it less and less, I was speaking to the people, Dr. O'Patterney's team in public health this morning. I was told that we've seen an increase of 10% in our screening, and that means that the people, if I look this week versus last week, 10% more people were screened. And I think that's good news, because that is what we are asking people to do. Despite the fact that we're seeing vaccination coming, we have to be extremely prudent if you have any symptoms at all. So that stat, for me, demonstrates that people are sensitive to this, and they do go get screened. And regardless of the results that we get, I think that we must continue to ask people to get screened, and that's good news. Question? I wanted to know, concerning domestic violence, the recent cases, what measures will you put in place following the report submitted by the Transpartisan Report on Domestic Abuse, and what is your timeline? We want to apply all of the recommendations that were made by the committee. We've already announced a plan. We're working on publicity, on financing of organizations who support women and men and violent men. And without revealing what will be in the budget on Thursday, we will continue to invest. Of course, it's not a problem that is simple, and we all find it terrible to see cases that keep occurring like this. We have to change society. We have to educate people. And perhaps we'll only see results over the medium term, but short term, we want to make sure that all of the people who need help and who need a physical place to go to, that they have a place to go to. And we're working with police forces as well. Geneviève Guilbeault is working with police forces. They're sitting down, well, whether it's for domestic abuse or for the cases of minors who have pimps and who are trafficked, they're like slaves. The police officers are also on board with this, the different police forces, in order to find some means to be more proactive. On the pandemic, you're calling on Quebecers to continue to respect the restrictions to avoid the transmission of COVID-19 before the variants become more and more present. Now, how do you reconcile in your recommendation the people who have had enough of all these measures with the nice weather coming and the true risk of this third wave? Well, these are discussions that we have. You can see today, we're taking a certain risk by saying in the red zone, students in secondary 3, 4, and 5 will go to school every day. But we calculate that it's a risk that is worth it because there's an impact on learning, on socializing, on mental health for young people. So we are trying to find the right balance. Same thing when the curfew went from 8 p.m. to 9:30 p.m. Unfortunately, there are some people who saw this as an invitation to go visit people. So obviously that's not a good idea, but we're trying to find the right balance. We're trying to find the balance, and let's remember as well that vaccination is moving forward. We are still aiming to have people 65 and over, all those who want the vaccine, that they'll be vaccinated by the 15th of April. So as of the 15th of April, well, we will have 80% of hospitalized people, actually, who will no longer be hospitalized, or much less anyways. Question? Mr. Premier, you know that there's a significant increase in the number of cases in Ontario. There's a lot of variance there as well. Did we think about having roadblocks so that people from Ontario do not come to Quebec? And we know that in the Outaouais there's an increase in cases, and there's a lot of Ontario tourists here in Quebec. Well, we have to look at the situation in Gatineau and the Outaouais, right? We see that there's an increase in cases. However, a lot of people work in Ottawa and they come back home at night, or the opposite, the reverse. And we have to be realistic. Now, Ontario is at 1,500 cases daily. The epicenter of the pandemic is more in Toronto. So no, for the time being, we're not considering roadblocks. We're not looking at that currently, not on my part anyways. Mr. Arruda, you had something to add? No, it's exactly the same process. We're not going to close borders between provinces, but we have to respect the measures, right? In the same way that if we go into, I'm in a red zone, I'm not going to go to the restaurant in Quebec because it's an orange zone. So we have to respect these elements. And so this balance that we're trying to find, if we respect the measures, the risk decreases. But the problem is people can't open everything because we've opened just a bit, right? Now, concerning the program of what we call the guardian angels, of people asking for asylum who worked in the healthcare system, we received in Quebec 721 requests for permanent residence, but only 3 were accepted, whereas in the rest of Canada, it's 459 out of 932. How do you explain this discrepancy in the number of people whose requests were accepted? Well, the criteria were set with the federal government. So I suppose that if they've got a similar program in Ontario, the criteria should be similar. People have to work in the healthcare network for a certain amount of time, a certain number of weeks, but there's no indication that is given to not accelerate the acceptance of these people. To the contrary, We want to respect, we want to keep our promise, and perhaps I can check and get back to you. We will now go to the English questions.
Good day. I'm just wondering if you could explain and elaborate further about the decision to allow high school students in red zones back full-time in class. There've been high schools that have been closed recently because of the variants. We have the UK variant increasing. Can you walk us through that? Explain to us why it's safe to do that?
In fact, there is a risk every time you put open schools. We know that there is some, I would say, outbreaks in school, but they are controllable. We can control them. Sometimes it's a case. Actually, when it's a case that we do a big, I would say, intervention, we could look at the effect for kids for not being in, I would say, in high grades, 10, 11, 12. There is some students who have very difficulty with alternance, and there is students who are going to miss their year if they are not at school. So, and because of the, I would say, mental health also in youths, we think that actually there have been enough privated since now, and we can balance that risk actually. And I think there is higher risks of problems with staying at home, failing school, and mental health, comparing to the risk that there's going to be outbreaks, but we're going to control them in a way that we can. I think the benefit is going to be better than the side effects.
Thank you. And Mr. Premier, you have not ruled out tax money for a baseball stadium in Montreal. You've left the door open in your remarks. Can you explain to us why the last time a government got involved in a big stadium, the Centre Vidéotron, there was a lot of criticism. Why would you want to put tax money into a baseball stadium? Okay.
The principles that we will use to help or not this baseball team is to see how much additional revenue do we expect to get from this activity. For example, the baseball players would pay tax in Quebec. So the idea is to give back less than the additional money that we would get. So that's why we've used this new way of giving loans to accompany, and you know how much it costs for a new franchise. So there's a value for sure. So you loan the money and you give the grant only if you have additional revenue at the Ministry of Finance. So it's a win-win situation. So in fact, it's a part of the additional revenue that we are ready to give back after 5 years.
Katsuni, CBC.
Good afternoon. I would like to go back to the people with health conditions that will be that are supposed to be next in line to get vaccinated. You said in French that there will be a committee with a list of people. Can you elaborate on this? Because for me, we're kind of a bit late to put this list together, and you may have lots of questions from citizens. How come I'm not there? Why this person is there?
First of all, thanks for the question. First of all, the committee has already met, I would say, this Monday. They are validating the process. They will react to what have been the resume of the meeting. In fact, the first factor for getting hospitalized or dying was age, especially over 65, 60. That was the first factor. And it's why we did priority with those groups, and it was clear everywhere. And now we are getting into the 65, 60 persons, which there's going to be people with conditions, of course, so we are not late. We are getting into this for helping, because I would say if we had a lot of vaccine, we would not do those priorities. We will make people open the bar and let's come here. But because there is less vaccine, we have to choose the ones which are at higher risk of having a disease. First of all, it's not all kinds of cancer. It's not if you're having chemotherapy or have been operated. Those people don't have the same risk. And we ask clinicians to tell us which criteria we're going to use till we get enough vaccine. And I would say our aim will be, let's have vaccine and do all that people all together. But that's not the case actually. It's why we're making that, because we want to prevent hospitalization and people dying from the disease.
Okay, going back to what's happening in Lower Saint Laurent, Bas-Saint Laurent, public health is saying that this region has become an example of how hard it is and how quickly variants can hit a region. You have now 700 students that are in isolation. This is in no time. And the percentage of people that have received their first dose in Bas-Saint Laurent, it's about less than 9%. So is the strategy working?
Yes. About the strategy.
About like fighting variants, making sure that you said that in reopening.
Vaccine is one part of to help people not to go to hospital, etc. But variants are going to. It's impossible to don't see the variants going up. But what we're doing now, we are controlling them. We are, as soon as there is a case of a variant, there is a enquête épidémiologique. We have very aggressive screening. We ask people to stay home before getting the test, and that is controlling the transmissibility of the disease. So, I think the only issue with vaccine is that we don't have the quantities that we would like to have. But I think in the next month and in April, this is going to be an acceleration.
Stéphane Giroux, CTV.
Yes, Mr. Premier, you said earlier that you're ready to take the chance in reopening classrooms for secondary 3, 4, and 5. I understand also that in seniors' homes where the vaccination was done, you're ready to reopen dining areas. Given how fragile that segment of the population was, is 75% vaccination rate enough to protect everyone in those seniors' home and good enough to send them back to the dining room?
In fact, probably more than 75 have been vaccinated in those settings. But, we don't want to discriminate, I would say, people for different reasons. Some person have been refusing or not. And when there is a lot of persons vaccinated, those ones are protected. They must wait for 3 weeks before doing things. But it's not going to be open bar at the room, dining room. It's going to be a kind of dining room exactly like restaurants, only with the same 2 persons coming from 2 houses or units with I would say plexiglasses, with more meals times for making sure that there is not too much people in. So it's a balancing risk, because we have been having a lot of stories of people getting mental health problems, no stimulation of them. So we are balancing, and we think the risk is not so high if people respect those things.
Merci.
Vincent Verville, Global.
Bonjour. I have 2 questions from Montreal. So you said that schools are good. We have good news for schools in Montreal. But do you have a timeline for restaurants to open?
That will depend on the evolution. They are open in orange zones. In Montreal, we'll see. We are now trying to work in, we say, on the planification of what could be next steps and next steps and next steps. It's clear that spring is coming, but actually it's not spring. And please don't act like if it was spring. We still have to be prudent, actually. But I would say there's going to be a progressive approach. It's spring, yes, but I would say that
As of Saturday.
yes, it's clear. It's like I don't know the dates of elections of Canada. It means that I don't know where we are. It's really spring, but in fact, it's not the weather we are used to have at this period. This is what I want to say. Don't forget that in April, on te découvre pas d'un fil, so there's going to be snowstorms. I'm just telling, it's not the time to have parties at home, but we will do some adjustments, and probably getting outside is something that's going to help us to perhaps open certain kinds of terrace or everything like that.
Dernière question.
Hospital staff in Montreal or everywhere are saying that they're worried about tackling a third wave, okay? Because employees are quitting due to work overload. We know that you're still hiring, you're still training, but will that be enough?
About the third wave?
About the fact that the employees are in hospitals are worried about the third wave,
okay,
because they see a lot of employees quitting due to work overload. So you're hiring, you're training, but is that enough to reassure them?
We are. I think, and my minister can react. I think we are preparing, and even I would say having a lot of staff for vaccination and everything. And it's why it's very important that we stay prudent for not putting the system of healthcare under too much pressure.
Just one comment. I was in Anna-la-Berge this week, and I was also in Surroi, and I think what the employees on our health system, what they appreciate is that the effort that we do on vaccination is being done outside of the system. And that's the reason we've asked the pharmacists, and now we're asking the companies to come and help us. And I think if we're able, in parallel, over the next 2 or 3 months, to unload pressure on our employees in the health system while we vaccinate, I think that's the best thing that we can do for them, because we want to respect their holidays this year. We want to respect them for all the work they've done. But I think if we can do something for them is to do the vaccination a little bit on our own. And I think this is what we're trying to do right now.
Merci. C'est ce qui met fin à ce point de presse.
That is all for the press conference. Thank you.